So we've heard some recent information about these drugs called ARBs in the news. And I guess my first question for you is, are you concerned about this information that's come out linking ARBs with cancer?
Patients have been reading in The Spectator, and in The Spectator there's an article about ARBs and Micardis and cancer, and they're calling me and they're saying, what should they do? Should we stop taking our medication? Is it safe to continue our medication? And as a family doctor, I'm confused. I'm not sure what to do. What are your suggestions?
Just like your patients, my patients have read this article as well. And the advice that I've been giving them is that this class of drug, this ARB class of drugs, are very effective in controlling and protecting the brain, the heart, and the kidneys. They've been used for a long time. In this particular study, that showed there was a slight increase in cancer with using ARB. There are many flaws in that study. And before we make conclusion or come to conclusion based on that study, one has to be very, very careful. And I agree with Dr. Titus that before we change our behavior, we have to get more information. But at this moment in time, using ARB, Micardis, would be the way to go. And then wait for more results. Because the study has flaws. It's not a scientifically sound study. But should we change our practice right now? The answer is absolutely no. This class of drugs are very useful in patient care, controlling the blood pressure. So my advice to my patients right now is continue taking those medications. FDA has come very clearly in saying that this class of drug is safe to use at the present time. So we should wait for more data to come before we change our practice. So that's my advice. Continue this class of drugs, Micardis, ARBs, quite safely.
Yeah, that's really good advice because as a family doctor, sometimes it's very confusing when patients read something in this article or they hear something from someone else. And the patients are alarmed and they say, what do I do? Do I continue? Do I stop? And some of these patients, or most of these patients, are so well controlled, and it's so important that they continue on this medication then.
Yes, I fully agree with you. I think discussing with our patients as to why they're on drugs, what the side effects are, what are the benefits, really helps them adherence and compliance with the medication. So right now, my advice to the patients and patients taking ARB is continue, because we don't have any proof that they cause major concerns right now.
Well, that's good news because my wife is on it and so is my mother. So it's good to know.
Correct. I think we should wait for more and we should be open-minded. And like many things in life, we just have to wait and see. But at this moment in time, if we have a backing from FDA, I feel very comfortable taking it myself if I had to.
Well, if FDA is behind it and if Dr. Panju is behind it, I'm good with it. So thank